Hi, everybody. I'm Marko Vujicic. Welcome to today's webinar on the economic impact of COVID-19 on dentistry. Where are we heading? I'm hosting today's webinar. I'm the Chief Economist at the American Dental Association and the VP of the Health Policy Institute within the ADA. And it's a pleasure to welcome a very distinguished panel. We'll get to intros in a second. But this week is obviously a really important week in healthcare in America. I guess we've hit 7 figures, I believe today was announced in terms of number of cases. We just crested over 1 million. At the same time this week, we're also seeing several states announcing their plans for reopening the economy. And even specifically a lot more clarity on how states plan to reopen the dental care sector. So we're going to get into that and much more. Let's introduce our panel, if we can. So joining us today, we'll start with Steve Beuchaw. Steve is the director at Wolfe Research. Prior to that, he was at Morgan Stanley. He's leading a lot of analysis, specializing in life sciences and medical devices sector. So a wave to everybody, Steve B. There you go. Okay, thanks. We also have Joanne Fontana joining us. Hi, Joanne. Welcome. Joanne is at Milliman, where she's in the health practice and has done a lot of analytics related to the insurance sector, including dentistry. So welcome, Joanne. Ty Hamilton. Ty is joining us from P&R Dental Strategies, another heavy analytics firm doing great work in dentistry. She's currently the COO there. Welcome, Ty. And rounding out our panel is Steve Thorne, who we've had the pleasure to have on a few of our webinars in the last few years. Steve is the CEO and founder of Pacific Dental Services, one of the largest and leading DSOs. 650 practices and rising. Am I right, Steve? Yeah. So wave to everybody. So here's what we're going to do. We basically have a discussion around 2 topics today. We want to spend a little time with the panel discussing what we've learned about the impact of COVID-19 on the dental care sector so far. Let's say a month roughly, or 6 weeks or longer, depending on where you sit. That's going to be, again, still a backward-looking discussion. But what's really, really neat is each of the panelists is bringing a lot of unique data. This webinar is not really focused on the clinical side, although we will touch on that with Steve. But we want to really show the latest data on what we're learning about how the dental care sector, economics-wise, is being affected, and what's happening with patient volumes and how dental practices are handling this during, I guess, the shelter in place or the period of shutdown. We're then going to turn prospectively and talk about what the coming weeks, months, and years, frankly, we'll cover all those timelines, are going to bring in terms of what the trajectory of the recovery in the dental care sector might look like. And here again, it's really great to have panelists that are bringing new studies and new data. Some of the data is as of yesterday. A lot of great research that you'll hear from each of us. And so that's the plan. So if we go to the next slide, Sylvia. So in HPI, we set up a poll to track dentists every 2 weeks. And it's a very large, last week we got over 6,000 responses, very large representative sample. And we've been doing some basic tracking. We have 3 waves of data. And I want to just open it up by showing some of the latest results. So the bottom bar is data as of last week, and it represents our 3rd wave. So here's just a snapshot of the status of dental practices. These are national data. at ada.org/HPI. You can get all sorts of refined cuts of these data, state by state data. But as you can see, I mean, this has been a large scale shutdown of non-emergency dentistry in the US, and it's been pretty dramatic. We have 80% of practices closed except for emergency patients, another 17% closed fully. So the sector, again, I see it as being very proactive and trying to help flatten the curve and trying to preserve PPE, but the reality is the sector is largely shut down. We also track patient volume and collections. So the next slide shows you some information related to that. And again, the red arrows are pointing to last week's data. What we ask is please tell us your typical patient volume, and I'm sorry, your current patient volume and your current volume of total collections compared to what's typical in your practice. And as you see here on the top panel, 86% of dentists are saying, I'm seeing less than 5% of my usual patient load. So I guess this is telling us the extent of how much dentistry is quote unquote urgent or emergent. And on the bottom, you have the similar data for collections. So on average, about 77% of dentists are reporting their collections are less than 5% of what is typical. So again, big picture, and there are some variations across states, but frankly, not much. This is a large scale closing of the dental care sector the past few weeks. On the next slide, just to demonstrate, there are differences, and again, we have CEO here of a very large DSO, and Steve Thorne, and he'll talk more about this. We are seeing differences in how large groups are reacting to this versus the other extreme, which is solo dentists. And look, this is more just of a show and tell of the type of data you could dig into online. Again, that's at ada.org/HPI. But I did want to just show that it seems that large groups, which we define here as 10 or more dentists, are weathering this storm slightly, I guess, better or less dramatic cuts. More of them are likely to report that their typical volumes are in the 11 to 50% range versus solo dentists. And we don't know what's driving that and how persistent it is state by state, but it is an interesting difference across practice profiles. So that's kind of one of the highlights. And then the next slide is that it. So again, just some basic data on tracking from our team in HPI. At this stage, I want to turn it now over to Ty, who has a very valuable, unique, interesting data set that they draw on. But also, Ty, tell us what you're finding in terms of the last month or so, in terms of what you think's happening or what's happening in the data.
Thank you, Marko. Yeah, so first of all, what you're looking here at on the screen is, in fact, actually kind of the baseline. We started and took a look at with the guidance that started coming out with respect to essential and non-essential services. And so looking back at 2019 at each of the procedure codes that were present in PNR's database, which is in fact actually a very large cross-payer commercial insurance database with 3 billion plus records. So we were able to track back through over the entire year and identify the incidents in which procedures that would be essential had occurred within the population. We found that 17.7% of the procedures in 2019 were highly likely or probably non-elective procedures, which is pretty consistent with traditionally with almost a 70-30 split on wellness type treatments being done versus therapeutic or restorative treatments being done. As we've looked at this across the last 5 weeks, we find that those procedures are in fact actually the ones that we had identified as non-elective are the ones that are showing up in treatment patterns, and it is a very small percentage of traditional treatment services.
Okay, great. Thanks, Ty. And again, did you say billions or millions of records?
We have billions of records. The database is actually, there's 66 different commercial insurance carriers that are contributing their data on a monthly basis. And so we're able to look longitudinally and currently at trends and what's going on with respect to regional behaviors or doctor behaviors or location-specific behaviors.
Okay, great. Thank you. And we'll dig more into this when we look at the forward-looking part two, because I know you've done some projections as well on how things may look through the second quarter, which is great. So just a reminder, if you're just joining us, we'll be doing two conversations. This first one is about what we learned the past month. Our second conversation will be forward-looking in perspective. And we are seeing questions coming in through the Q&A box. Just as a reminder, the Q&A box at the bottom of the screen is where you can submit questions or comments. So keep those coming throughout. We have Adriana monitoring those in the background. I want to turn it over to Steve now. So Steve, I know you bring a unique perspective. Those of us that work in data, create charts and give insights based on billions of records of data, but you also have some stories as well that you can share from, I guess, the frontline providers that are in your organization. But let me turn it over to you. I know you have some unique data and some stories, so go ahead.
Can you hear me there, Marko? Yeah, great. Thanks for having me today. And like you, I'm a data hound and a data freak. I look at it every day, and I think we have some really interesting data here. Before the coronavirus hit hard, we were looking at dentistry probably having its best year on record. I think our data lined up with your data that the industry would do somewhere near $150 billion in 2020. Our estimates for this year now have dropped to about 52 billion based on our data. So we're expecting about, and I think that's probably consistent with others, seeing about a 66% drop in the industry. So to say it's devastating the industry is a massive understatement. It's been really hard. This first slide is just a look at what happened in our organization. So we have about 850 practices. You said 650, about 850 practices that we're supporting going into this. And roughly 740 of the practices continue to see patients through this, and still till today. So the docs all had a choice if they wanted to continue to see patients under the emergency orders of their particular state or not. So about 742 have chosen to stay open and continue to serve. But we had from a high of over 23,000 patients being seen in a given day to a low of 3,500 on, I think that shows March 25th about. And we've been able to increase that back up to about 5,300. So a drop of 85% patient volume in our supported practices around the nation, which are mostly in high visibility retail type of sites, and we have a pretty strong marketing team. But what we had to do was pivot the entire organization to start focusing on emergency care, and each state did it a bit differently. I think we all know that. Some were just hardcore emergency, some were emergency and urgent, some were emergency and emergent, and all these definitions flying around of what a dentist could and couldn't do. But I think this data shows you that there is increasing demand. I explained it to my organization that it was an elevator ride down. It's like somebody cut the cable for the dental industry, and it's going to be an escalator ride up. And you can see even with our efforts and the practices staying open, it's still a very slow escalator ride up. There's still confusion about what, even among the dentists, what they can do. We see dentists turning in other dentists in states for doing something they think was beyond the scope of what a governor said they could do or a board said they can do. We've seen governors issue statements of what the dentist should do, and then you see the dental board counteract what the governor could do. There's been a lot of confusion out there across the country, and I think it's just exacerbated the problem that has been that we're all experiencing. You know, in every 14 seconds, I think the ADA data is every 14 seconds somebody visits the hospital emergency room for some sort of dental pain or oral pain. And so most of our dentists really wanted to help out in this pandemic and step up and serve those and keep the patients out of the ER. And most ER rooms aren't set up for that. So to serve oral pain. And so we started this hashtag dental ER PSA campaign that's really taken root in the country. Most of you have probably seen it out there. Most organizations have gotten behind it. We've contacted thousands of hospital systems, ERs, urgent cares, and just generally raising awareness of what dentists can do to serve in this pandemic. And I'm going to put a little bit of different data out here that I know I love your data always, Marko. I love it. We got some other data of a very large vendor who we would all know that did just last week 19,007 phone calls to dentists, just random calls to dental offices. Only 3% were open and seeing patients. Only 3% open and seeing patients that day. So and that was within week, and that's really been our experience. If you were in the Pacific Dental Services Patient Contact Center, you would hear that patients are calling 5, 10, 15, 20 plus practices and not being able to get in, and they finally find one of our practices and are able to get in. So I think the government statements, whether it's from the governor or the dental boards, it scared a lot of dentists actually. And there wasn't good clarification on what dentists should do. So they just, rather than risk licensure problems, many dentists just stopped. You can see on this next slide, the volume that we've had, the increase in emergency volume. So yes, we've gone after emergency care to try to survive this pandemic. But also, a lot of those are new patients from other practices that were closed. And then the other one is looking just at the general call demand is down tremendously. We stood up teledentistry in 4 days. So it was really interesting to see how that worked because, you can't do a root canal through the video. So, but it has been very interesting and patients have really liked it. And I think it's here to stay because it'll be an excellent tool to be used for screening. But what we found is roughly a 60-40 split. So about 40% of patients have had to or did not need to come in, which I think is really helping. So we save all that PPE, but about 60% did have to come in for care in the teledentistry.
Okay.
So that's about where we ended up there on that, but it's growing. You can see the trend almost every day, and patients really like that.
And we'll get to the teledentistry too. I want to dive a bit deeper into your comments, Steve, about it's here to stay, and can this be something that can be scaled, right? It was interesting our poll last week, we included a question on teledentistry, more generic about are you billing for virtual consultations?
Right.
We had a quarter of dentists responding saying yes. And it was very interesting. That varied significantly by practice size. So the solo dentists were much more likely to be using teledentistry, and the larger groups were like 3 times more likely.
Right.
So I'm hearing you probably say that's the experience. DSOs are probably maybe better set up for something like this.
Yeah, and I think we all see it. There's many teledentistry companies coming up there. So the access to teledentistry is not going to be the problem. I don't think for the industry, it's there. It just depends which company you go with. It's getting it integrated into your system that's the key part. And how do you integrate it? How do you document it? How do you bill for it post? How does the conversation get into the electronic health record? There's lots of different issues around standing up a really good teledentistry program. It's not just picking up your iPhone and having a conversation, right? Because, right? And so I think our experience so far, and you can see, is that patients, like if you go to the next slide, it just demonstrates a quick story from one doctor and one patient talking about how a patient was triaged at the office. I actually talked to the doctor, Dr. Majors. She's been with the organization a long time, triaged. And when Dr. Majors told me a little bit more color on this story is when she got on the video with the patient, she could see physical changes in the patient's demeanor of getting comfortable and calm and relieved. So I think that's a whole element during this process that we haven't seen in dentistry because we haven't had teledentistry. Just the bringing calm to patients when they have some sort of problem. So
okay, good.
Thank you, Steve. I think a great story there.
Let me bring in Joanne. Anything to add or anything surprising or?
No, I found the topic of teledentistry really interesting because it's something we've been watching for a long time. So it's interesting to hear. I was always curious how much could actually be done via that mode, but you saying that, 40% of the people did not need to be seen in person, that's pretty significant and shows that there is a lot of value there.
Right. I think so. I think they see a lot of value.
Yeah.
Yeah, let's bring in Steve Beuchaw. I see your hand tied. Let me actually, let's go to you because my guess is it's about teledentistry.
I just wanted to say that because we are, from our side at PNR, we actually can see the claims on the follow-up side after the occurrence. We may not be able to actually see this dramatic increase that Steve's talking about right now, but we can see that there is increased utilization of teledentistry across the United States. It's in every state. There are more teledentistry incidents, but as of right now, it still seems like it actually, from the billing side of it, is still pretty small in terms of penetration.
Okay, great. Thanks for jumping in there. Very good. So very large data set that you could draw on. Steve Beuchaw, let's get you in. So you sit from a different perspective and see a different set of actors. What else can you tell us in terms of maybe the broader industry?
So right now, if you have a conversation with a manufacturer, and I would say the same thing about most of the clinics that I speak to. So DSOs, generally in the southern and western United States. What I'm hearing is, I'd say, well, certainly a very high degree of uncertainty, and there certainly are observations that are very similar to what you have in terms of the impact on visits and on practice revenues. I would tell you that there are practices that have really concentrated on emergency care, where their volumes of revenues are only down maybe 25%. So there has been an opportunity for some to deliver care in a highly responsive way. I think that there will be quite a bit of consolidation of dental practice downstream of this event, as smaller practices are struggling. They haven't been as front-footed, certainly not as front-footed as Steve's group with the marketing. And outside, particularly outside of metro areas, the differences are just extraordinary in terms of how different practices are looking at things. I'd say there's also, I sense very large differences in terms of how practices are operating regionally. In New York, you'd have one extreme. In parts of Texas or the Southeast, I'd say there's another extreme where the level of concern, the extent of the closures, and patient attitudes are all very different. So I'd say making broad generalizations here is very hard. I sense that as the manufacturers are looking at some of the same trends that I'm seeing, that they're generally more optimistic than the panel discussion here has been so far, but I'll talk about that a little bit more when I get to my data.
Sure. You know what I'm going to do now, Adriana, let's actually bring you in. I see there's a lot of questions coming in. Maybe we can take one or two if they relate to this part about the data.
Yes.
And what we've been doing so far before we turn forward. So why don't you throw out a couple?
Yeah, of course. So there's a lot of questions coming in on teledentistry. So I'm taking notes of some of the most common topics. So people are asking what platform Steve is using, how is billing done? Somebody mentioned that hygienists have been using that to treat underserved populations for a while. There's another question about how teledentistry is integrated with practice systems. So I think that covers the gist of the teledentistry questions that are coming in.
Okay, let's do a quick one on that. I know there's a lot of resources out there, including on ada.org/virus. There's a whole teledentistry center. As you said, Steve, there's lots of companies. But what would you say, let's go to each of you. What would you say is like one thing where you think we need to do better to expand, let's say, teledentistry? I don't know, let's start with Steve B, because you were just talking about this. Give me one thing that we can do better.
I think the number one thing is really the communication with the patient. The awareness of this as an option is still very low, and the ability of most patients to engage is still pretty limited. We're all here on video cameras and comfortable with Zoom. This is not as widespread across the populace. So I'd say, as we say in my business, and we talk about folks that we're working with, whether they're clients or otherwise, we're trying to retrain a lot of people, get people comfortable with being virtual. I think that communication and that training with patients would be necessary as well.
Okay, Steve Thorne.
Yeah, right. I think you're spot on, Steve. It's one of the things that we will see with this crisis is it's going to be catalytic to a lot of change in dentistry. And teledentistry is one of them. And it's here to stay as not only a way to triage, but also a way to pre-screen. The issue we'll face long-term is that dentistry can't be done through video. So it's the triage is the vital part of it, and how that gets done, whether it's you said maybe a hygienist, it could be a dental assistant until the doc gets on. We've all gone to physicians' offices where maybe a nurse practitioner does most of the triage, then the MD walks in real quick. We haven't quite figured that out. I want to tell you we have figured that out. Okay. But we have to get reimbursed for it. So we've stood it up. It's as I've said, we're keeping 40% of people out of the office right now. And I don't, from Ty, you may know if we're getting reimbursed. I actually don't even know if we're getting reimbursed or not for it. We don't charge patients, I don't think, directly for it, but it's a benefit to employers. It's a benefit, the payers, I think, of oral health. And so we need to get reimbursed.
Yeah, it's a great dynamic. Go ahead, Ty.
I was just going to say, Marko, to that point, I think that the commercial insurance industry has been kind of very responsive to teledentistry and the role, particularly through the crisis, and how it can help in triaging and responding and pre-screening and making sure that patients are getting to the right place to get the right care for essential services. Government programs have been, a lot more and equally embracing teledentistry for years. And so it mentioned ways in which hygienists in lower served areas and rural areas expanding treatment. So I would say that actually I echo everything that Steve and Steve said in terms of integrating it into the customer experience so that they're aware of it.
Can I add one last thing, Marko, just to plug for all the specialists out there in the country that I think teledentistry is totally optimal for specialist consultations. So patients present all the time in GPs and they need a specialist consultation. They don't necessarily want to get in their car and have to drive to a specialist's office. So as we're thinking about the broader system of teledentistry, let's not get tunnel vision in just to the GP practices. Let's think of how the GP works with the physicians, works with an oral surgeon, works with a nurse practitioner, works with a periodontist, and those type of things. So I know,
So
Ty, you can have a lot of impact.
I'll go one step further, Steve. What about a world where somebody presents to their physician or a pediatrician and they ask about, oh, I have a toothache or something like that,
Yeah, well,
or I haven't been to the dentist in 3 years. Imagine zooming right in using.
we're
Zoom.
we're doing that right now. We're testing that because, you know, we're moving to Epic, and Epic is integrated with 65% of the healthcare system. So we're actually experimenting with that right now, Marko.
All right, we're getting into our future discussion. So one more, Joanne. Any
I just
last
had to
thoughts
give a
on
plug for all the specialists out there. You know, they work hard too.
Joanne, anything to add?
No, not really. I was going to echo the comments that Ty made about, you know, a lot of my clients are insurance companies, and I have seen them, you know, embracing including teledentistry services as part of their covered benefits that they're selling to employer groups, and, you know, trying to kind of get ahead of the curves. And this very well may be a jumping off point where it starts becoming a little more understood by the consumer, and, you know, maybe more to Steve's point about helping to reduce patient anxiety, may be a way to help, you know, make this kind of a marketable piece of an employer group's plan.
Yeah, great. Good. Adriana, one more maybe before we go on to the forward-looking discussion.
Okay, a lot of the questions are more forward-looking too. There's one comment here from George. Teledentistry rehash. Any statistics on infection rates of the dental workforce or dental patients?
Yeah, I can chime in there, Marko, and I plugged you yesterday to see if you had any national data. But I can, we've had 65,000 emergency exams at 742 practices in the last, I think this last 45 days. So lots of patient visits and contacts, and we don't have one single documented transmission of the coronavirus in the PDS system. I checked with some of my peers. I don't have their data up to date, but I do as of last week. So my peer groups have the same thing, not one documented transmission of the coronavirus in a dental practice. Dentists are safe. Dentists are getting safer.
And I guess, Steve, can I push on that? Like, what PPE are you guys using? Have you adjusted to the?
It's a question I got when I was talking. So when this thing came up, it's again to what I think Steve B was saying, is there's going to be consolidation. We started our crisis management meetings every day starting on March 10th. I think it was March 17th, we'd gone out and bought millions of dollars of PPE and had it all ready for our docs and our team members. So we haven't had a shortage of PPE. I did speak with Henry Schein and Patterson this morning in preparation for this video, and both there are strains currently in the system, but both commented that they think it's smoothing out and the manufacturers stepped up, and that we should be out of the woods no later than towards the middle to end of June with plenty of PPE.
Okay. So on that issue, on the transmission, I think just so we don't get more questions flooding in about where did you get the PPE and what masks, we don't want to get into any of the clinical sides. The ADA has released guidelines for reopening. Different state dental boards have. Lots of that information is starting to roll out. We can all agree that the PPE supply chain is strained. There will be challenges. Steve, you're saying you were very proactive early on. But look, just to keep the Q&A free from all this, we're not going to go into that about the clinical stuff and what are the new guidelines. We're just all going to agree that that is going to be a limiting constraint to scaling up dentistry again. I think it's just a reality of not everyone's going to be able to practice how they want because there will be limits on the PPE side. On the infection transmission, I think in terms of, thank you for sharing those data, Steve. So I think that's a big data void. I think we've all seen the studies that have been, or the statistics and some of the graphics in different areas that I've seen, comparing the risk of different healthcare workers to COVID-19 exposure. And the dental team in all those analyses ranks very high, right? So I think it's very important that we do start monitoring this. And you know, I've asked around. We're exploring this within the ADA. Like, how can we help make sure there is some research in this area, because it's very important to keep the public and the team safe, right? But thanks, Adriana, for the question. Let's move now to the forward-looking part, and we want to talk about now, very bluntly, where do we see recovery? So there are a few states, I think, that have officially lifted the restrictions on dentistry this week. I think there are more rolling it out next week. The coming weeks, we'll see this. But I know each of us have done some analysis and some projections. So for this one, I think we want to start with Joanne. So tell us a little bit about the analysis you did, Joanne,
Yes.
and the punchline.
Okay. So being an actuarial consulting firm, you know, our firm is doing a lot of research in the COVID-19 space, as you can imagine, and there's a very few of us that think specifically about dental issues. So we wanted to be proactive and put together some kind of thought framework to help various stakeholders in the industry just think through what might happen in the short term and in the longer term regarding demand for dental services. So we wrote an article. It was released a few weeks ago. At that time, it was pretty speculative, and you know, now looking at it, I would probably need to update it based on emerging data. So it goes to show that you know, this is all kind of happening in real time. So I don't want people to take these numbers as, you know, anything more than that. But we're hopeful that it produces a framework that people can use. Basically, what we thought about is that, you know, there's obviously the economic component of the situation we're in terms of, you know, people losing jobs and things like that. We've seen that before. We've been through recessions before. We know that demand for dental services correlates with the health of the economy. So there's at least some studies we can refer to you know, get at that piece of the puzzle. But as we all know, this is a unique situation where, you know, leading up to that and the cause of that economic uncertainty is the pandemic itself. So because of that, we developed kind of a two-stage model to think through the phases of this process from the pandemic and through the recovery. So the first phase that we modeled was the pandemic itself, which we're obviously in the middle of. There's provider actions that we've largely already talked about, as well as patient-driven actions that are significantly reducing the demand for services. And I think we've all seen the great emerging data that Marko's team has developed, and everyone else on this call, to show, you know, how severe that has been. Then as we move beyond that, we've thought about the second phase, which is as the pandemic subsides, but there are lingering economic ramifications to the pandemic, including increased unemployment, reduced disposable income, people losing their employer-sponsored dental insurance coverage, and things like that, that will affect the economy in terms of demand for dental services over a slightly longer term. So basically all we did was use those two stages, looked at the ADA recommendations in terms of what procedures qualify as sort of urgent or emergency versus not. And we put some numbers around it. And we said, you know, as we're already seeing, that in stage one, you would see a significant reduction in all those services that are not urgent or emergency in nature. And then as we move out of that, it will turn into more of a standard economic downturn type of approach where, you know, you will continue to see the urgent and emergency procedures that are going to happen regardless, but you'll see a return toward normalcy of preventive procedures in particular, because for people that are insured, those tend to be free at the point of service. So a little bit easier to afford versus some higher order procedures that do require cost outlay from the consumer that might return up to normal more slowly. So we basically put all that together, and I'm not going to go through the assumptions in detail. The article is out on the Milliman website if anyone wants to look it up. But we basically projected what we thought would happen in years 1, 2, and 3. And year 1, just to clarify, is this calendar year. So included in our year one projections, that's really calendar year 2020. So there's a couple months of normal behavior before the pandemic hits. But we were showing in 2020 anywhere between, a third, or I guess a quarter and a half of dental demand being reduced.
That's your first column there.
Correct, the first column. And then moving forward into 2021, you've got the lingering impacts of that plus the economic downturn. And then going off of the kind of Great Recession from the late 2000s, like 2007 to 2010, it did take a while during that downturn for dental services to actually move back up. And I think they never actually quite got back up to pre-recession levels. So we were using that framework in terms of showing that even 2 years out, there may still be some small depression in actual claims being, brought in versus what we have seen prior to this.
Okay, so Joanne, if we're reading this right, this calendar year 2020, you're talking somewhere between a 23% reduction up to maybe a 58% reduction. That's kind of the range. Am I right?
That was this is by class of service. So sort of like class 1B. So if you look at the bottom lines, it's really the 27% to the 52%.
Got it. Okay.
Yep. Good. Just the key things I wanted to make point of that I think we've already talked about are, again, this is still pretty speculative. We don't know how long the pandemic will last. We don't know how long shelter-in-place orders will last, and they'll vary widely by state. We don't know how long the economic downturn will last. So this is something that we'll continue to review and update the framework as we get more data, but hopefully just the thought process is helpful as people want to apply it to their own situation. The other thing I wanted to mention, because again, a lot of our clients are insurance companies, is that this is really a look at the economy, and demand. It's not a look at how will somebody with dental insurance behave. I think that's a little bit of two different stories there. So it's not meant to be kind of a prospective, how do I set insurance premiums for the next year? It can be used that way, but I think you'd have to make slightly different assumptions.
Got it. Good. Great. Thanks. So very good. So we're looking at the first, and then obviously year 2 and 3 are smaller contractions.
Right.
Good. So I know there's lots of questions coming in. I want to speed us up a bit, but I want to turn to Ty. And let's just give disclaimers across all of us. We're doing research based on a lot of assumptions. Things are changing week by week. We all need some leeway there. Certainly from our perspective, don't take this as gospel. We're probably all going to revise these estimates in a month as we go. But with that said, Ty, give us the punchline of what you think will happen the next quarter, right? This is Q2 projections.
We actually do standard analytics where we are, in fact, actually looking at Q1 data, completing for incurred but not reported claims at the end of the quarter, and then projecting into Q2. So this is one of the standard analyses that we're actually running. So when we went in and we looked at this based on the database data, the Q1 originally going into Q2, we were anticipating utilization to be about the same with some year-over-year increases in dollars. But more importantly, actually, there was an increase in commercial insurance, dental insurance in the United States. And so overall, it was really tracking at an increase year over year, that 2020 was going to be more than 2019. And with the end of March kind of implications, Q1 wasn't impacted very much. But as we looked at essential services and non-essential services, and we talked a little bit about this a little while ago, which procedures dentists do that were going to fall within that, and started adjusting the projections. If the essential only services holds all the way through Q2 to the end of June, we were actually projecting an 80% drop in utilization And in just Q2, more than $40 billion in lost revenue. So that's the punchline that you see here.
Great. Okay. Thanks. And again, for those of us with reports online, all the assumptions and methods are there. You can follow up more directly with Ty if we wish after. Steve, let me turn it over to you. You have some fresh new data, and that maybe gives a bit of a different perspective.
Sure. So when I saw some of the initial takes on where things might go, it struck me that there would have to be preconditions to these, for the full year in particular, for these things to happen. And one of them would have to be that there would have to be either a pretty substantial pullback in dental coverage or a pretty substantial pullback in an individual's willingness to actually seek dental care because there's some sort of safety concern, let's say. So what I've tried to do, and this is work that is pretty timely, my consumer level data is actually from the end of last week, is try to look at it, and we've broken it down by region and just ask people, okay, how many times you go to the dentist last year? How many times have you been this year? How many times do you plan to go in the next 90 days? And what about the full year? And the answer was shocking to the upside. On the aggregate, they expect no meaningful change. And this is a very large sample of US consumers all over the country across a very wide swath of different income levels. And with the exception of indications of dental care plans for the next 90 days on the East Coast, the indication is really there's nothing new. That tells you that these people either think that there isn't going to be any meaningful change to their economic situation or coverage situation, or it tells you that. It also tells you that they aren't particularly worried about safety outside of, well, my neighborhood, basically. If you go to the next slide, another way to cut this is to look at it across different countries. We've looked at web search volumes around the US, and I have this cut by state, which sends some interesting messages as well. But if you look at it relative to a place like Germany, where they controlled the outbreak very, very well, there are huge differences in the trend. That tells you that people are acutely aware of the situation, and their behaviors are likely to change as a function of the situation. If you go to the next slide, I try to very quickly take a look at the overall coverage dynamic, because it's not lost on me that unemployment has surged. But if you look at the aggregate outlook for healthcare coverage, inclusive of employer coverage, we have data here from government programs, non-employer, and Medicaid. And this is not from Joanne's team, but it's from an actuarial team that we work with. The outlook is for things to actually not change all that much. And I know there are a lot of layers in there, and I'm happy to talk about it if you want. But we expect a pretty significant rotation from the Affordable Care Act exchange plans, which were pretty common in areas where people might be, facing accelerated job losses, onto Medicaid programs as a function of relief efforts that are happening right now. And if you don't think Medicaid matters, you look at broader healthcare expenditures on the right here in the US. You can see what happens in 2014, 2015 after Medicaid expansion. It's a huge driver. And Medicaid rates aren't great, right, Steve Thorne, but it does give people, in some cases, coverage they didn't have before. And then on my last slide, just to flag, I think it's important, and I'm echoing a point that Joanne made, there's a ton of data out there that we'll want to keep tabs on, and we'll keep you posted. That'll help to give you a sense for what things look like on a month-to-month basis. So that's it for me, just a little bit more optimistic take on things. Great,
and great to bring in different data. All right, so Joanne had somewhere in the range of, let's say, 27 to 50-something% decline this year. Ty talked about an 80% reduction Q1 versus Q2. And Steve, you earlier had mentioned your projections. Steve B here has a different perspective. Maybe consumers aren't as pessimistic as we may think.
Right.
I just want to flash, I'm not going to go through the details of our report, but we launched last week a projection as well. If you can put that up, Sylvia.
I just thankful Steve's on here, and I hope he's right.
Yeah, that's why we have different panelists, right? Everybody's bringing different data and perspectives. But look, I don't want to. You can go online and get this. This is our set of projections. The only thing to show is Joanne mentioned. If you look in the middle, the Excel chart there. we did not kind of get back to the projection line of dental spending post Great Recession. We definitely started to grow, but it took the dental economy several years really to get out of stagnation, long after the rest of the US economy recovered. So I think that's one thing that maybe made our projections a bit more on the downside. But if you go to the next picture, we have 4 scenarios. We'll leave this for anybody that wants to look at. Basically, these are 4 different paths of where dental spending will be. On the worst case scenario, we're projecting a 2/3 reduction this year in dental spending and up to a 1/3 reduction next year of total dental spending. That's relative to projected spending, not 2019 current. And on the upside, it's not as big. It's 50% this year and potentially nothing next year under what we think are rosy economic projections. So just to be clear, we actually think the data now, based on what we feel economists are saying about the economy in general, we're leaning more towards what the pessimistic side is. So. But look, these are going to be updated. We're going to know very shortly, in a month or so, whether we're seeing a big bounce back in patient volume. And I think it's interesting, is this going to be like a V-shaped recovery, or is it more like what Steve Thorne said, like the elevator down and the escalator up, which I guess we're saying it is that. I mean, these charts here are saying it's an elevator down and an escalator up. Well, look, this has been great. Let's get to questions. Adriana, I want to turn it to you to kind of lead us off here.
Yeah, so thank you so much. There's so many questions. I'm not sure we'll be able to address all of them. I'll start with, is an anonymous questions. Outside of teledentistry, what do you see as the biggest change our industry will see?
It's a great one.
Yeah. I'd love to take a stab at that one.
Yeah,
Marko.
go for it.
So 32 years in this space, this is all I've done, but I think many of you know my history here. And this crisis, this pandemic is really putting a spotlight in my eyes on dentistry and the identity of dentistry. Immediately, it feels like dentistry got put on the back burner to other more, they would call essential healthcare. That wasn't our experience with the 65,000 patients that had to come in for emergency care. And I think dentistry coming out of this can unite in a stronger way to kind of solve that identity crisis that I think was elevated here and we dentistry's experience. So some of that data, Steve, I have the latest ADSO data too on, and these are the bigger group practices. And as of 2 weeks ago, they were down on average 91% in revenue. And it's only gotten worse in the last couple of weeks. Now I hope it gets better in the next few weeks as states begin to open. Actually, Marko, yesterday was our best day of business.
Steve, let's think longer term. Look,
we're
between a V and a U and all that. This question's really, what do you think will be long-standing?
Okay, so
identity crisis. I like that. We say we have to resolve that.
We were entering, and I loved your data there. You're 18. It stopped at 18. 19 was a really good year, I think. I don't know if you've gotten prelim data, but my cohort and group, 19 was a good year, and 20 all the way through March 15th was better than 19. So I think we were catching up to that the post financial crisis, actually doing pretty good.
Okay.
I think we are entering. My take is we're entering the golden age of dentistry with technology, with implant dentistry moving to 3D, the dental medical integration happening, the comorbidities. If we just look at just that one, the comorbidities with what's going on with the COVID-19 crisis around hypertension, around diabetes, around cardiovascular health, and the things that dentists can actually impact, I think we're actually entering the golden age of dentistry, and this will be catalytic to speeding it up.
Okay, good.
But I think we're going to have some tough times for a couple of years. I think I like your projections a little better than Steve's for the short term, But if I look out 10 years, I've never been more excited about where dentistry's at.
Great. Let's go quickly. One thing that you think will be transformative going forward, Joanne.
So I am not a dentist. I am a patient. And from my perspective, I just have to imagine your operations are going to have to change significantly. You know, I sit in Connecticut, so I was one of those zero consumers said they were going to go to the dentist in the next quarter. You know, I think there's going to have to be a change operationally to assuage patients' fears of, you know, contracting airborne illnesses, et cetera. I see PPE being a big issue, things like that.
Okay. Ty, just quick, give us one.
Yeah, so Marko, as we've discussed, one of the key things that I think might actually change the dynamic more so than anything would be the number of offices that are affected in the near term economically, such that they don't reopen at all, just workforce completely. One of the things that we've looked at is corporate large group expansions over the years, and we've been kind of tracking that. And you've got greater than 40% of the offices that have a primary dentist that is over the age of 60. And so aging workforce combined with the economic pressures may in fact actually accelerate some of the changes that we were already anticipating with merging, consolidation, different ownership structures.
Okay. Steve and I'll skip this one. Let's go back to Adriana. I'm realizing, I mean, we had over 1,600 people registered. We have dozens and dozens of questions. We're going to have to reconvene this again, because obviously there's a lot of interest in this, and I apologize to the audience. We should have done this maybe 90 minutes, but look, we're figuring it out. We'll play by ear. But Adriana, give us one more.
So I'm trying to consolidate as many as I can.
You're doing a great job.
Thank you. Quite a few questions were about patient sentiments in insurance due to unemployment. What are you seeing about dentists, about patients? Are they coming back? Are they rescheduling their canceled appointments? And do you expect insurance, lack of insurance to be a problem in the coming months?
Okay, so let's give Steve B this one. So, I mean, you presented the consumer data that your take is it's fairly positive. There'll be a bounce back, right? Is there anything you want to add to that from other data sources or anything else, Steve? Or
in the data, which again is across a lot of different income levels, if I thought that there was, and it's a large group, if I thought that people were in any observable way worried about coverage, then it should have showed up in the data, and it didn't. I got zero signal at all. And I think I know why that is. We don't have time for it right now, but I'd say this crisis is going to be very, very different than 2009 in terms of the way the consumer operates.
okay, so look, I want to respect people's time. We're going to just do a quick, I want you to think of one word in the next month that you want our panelists to think about. Steve, Steve Thorne, I'm going to use yours. You said catalytic. Am I okay just doing that?
Yes.
Okay. I'm going to say transformative. Joanne?
Gosh, I have to think of a word on the spot.
All right, let's go to Steve B. We'll come back to you.
This crisis is destroying a lot of people's preconceptions about how healthcare ought to work across all verticals. I think where it's going is more connected.
Connected, good. Ty?
I think that right now, that my primary focus is that recovery. It's started.
Okay, recovery started. Good. Joanne?
I'm going to go with integration.
Okay.
From Steve T's comments around being an opportunity to pull in, connections with medical, things like that.
Okay, and look, thank you all. This has gone fast. It's been a great discussion. Obviously, we need to reconvene and give a lot more time for Q&A. So apologize to all the folks that have been writing in questions. Maybe we can offline figure out some responses, some way to get back to folks, because I'm sure there's really rich insights that we can share.
Thanks,
so
Marko.
thanks everybody, much appreciated.
Thank you.
Thanks again to the panel. a virtual round of applause. Thanks to the audience. And I think we have a lot of optimism we've shared today in terms of what the months and years will bring, but let's look at the data in a month and reconvene. Maybe that's a good plan.
Great.
So thank you all.
Good job, Marko. Thank you for
Marko.
putting these together.
Yeah.
Good work.